Hello, everyone, and welcome to this episode of Teal Talk, an ovarian cancer podcast. Teal Talk is produced by the National Ovarian Cancer Coalition. You'll hear from medical professionals, survivors, and advocates to help guide you with knowledge, confidence, and support on your journey. Don't forget to subscribe, leave a comment with topics you'd like to hear about, and follow us on social media at NOCC National. This episode of Teal Talk is made possible thanks to the support of people like you and our generous sponsor, Merck.
Hello, everyone, and welcome to Teal Talk, an ovarian cancer podcast. I am Melissa Aucoin, CEO of the National Ovarian Cancer Coalition. Thank you so much for joining us today. In this episode, we are shining a global spotlight on a day that brings us together, World Ovarian Cancer Day. Each year, on May 8th, this International Awareness Day unites people across countries, cultures, and communities to raise their voices in the fight against ovarian cancer. To help us understand the history and the meaning behind this powerful movement, I am thrilled to welcome Clara MacKay, CEO of the World Ovarian Cancer Coalition, as our guest today. Clara, welcome to Teal Talk.
Thank you so much, and thank you for inviting me.
Let's do a little lesson today. Can you take us back to the beginning and talk to us a little bit about how World Ovarian Cancer Day came to be and how has it evolved over the years?
World Ovarian Cancer Day started the way many great initiatives do, and it was really a small group of very committed, passionate advocates who met at an international cancer meeting and were really struck by the extent to which other cancers had awareness days, and there was a lot of talk, and it clearly was an effective way of shining a light on diseases. And that was in 2012. And they decided at that very point, some say it was over a cup of coffee, some say it was over a glass of wine, but they decided that ovarian cancer really needed that same kind of focus and attention. So they went off, they very quickly formed themselves into a little working group and went off. And by May 8th, 2013, they had launched the first World Ovarian Cancer Day. And it was before my time, a little bit before my time, but that first year, and I hear people talk about it a lot, there were 30 organizations around the world that took part. They reckon they probably reached about 50,000 people worldwide. But what they really came away with was a sense that there is a huge appetite for working together globally to raise awareness of ovarian cancer. But actually, what they also detected was something else, and that was an ambition to create a global movement around ovarian cancer. So that was the starting point, and it has just grown exponentially. So each year, 30 groups became 50 groups, became 150, became 200, 50,000 people, very quickly became 50 million. And what's been really delightful for me has been to watch that evolution from being a very patient-centered, patient advocacy organization-centered initiative. And it's a bit like an onion. Each year there's another kind of layer. And so we went from really talking to women, talking to advocates, talking with advocacy organizations to involving clinicians and researchers, policymakers. Many health system, government departments now participate in the day. Right up to, we've had support from Angelina Jolie, Drew Barrymore. We have amazing global advocates worldwide, including First Ladies of Africa. So it has just really moved from being an awareness day, I say, to becoming a movement that we celebrate each year on May 8th.
Incredible journey and such a massive footprint that you've created there. And I think it really highlights the strength of collective action in just one voice can be powerful, but a global voice is truly transformative. So World Ovarian Cancer Coalition recently found that 26% of ovarian cancer patients in low-income countries had never heard of the disease before. Likewise, I think it's really striking that earlier research in high-income countries like the US found the exact same statistics. So what do you feel like this really tells us about awareness of ovarian cancer?
I think it tells us something, on the one hand, is very concerning. On the other hand, certainly for me, working in this area for a number of years, not entirely surprising. And I think what it speaks to is globally, just very low levels of health literacy amongst women. and particularly, I would say, very low health literacy when it comes to gynecologic health. We know, for example, that in many languages, there is no word for ovary. So if you don't have a name for something, how can you know what it does or know when you should be concerned if you have any health concerns? But we also know, and we do little mini surveys when we do our awareness campaigns, and we often ask this question, which is true or false? Does a pap smear screen for ovarian cancer? And I just am not surprised anymore. It is quite concerning the number of women who still think that a pap smear is part of an ovarian cancer awareness. And for those of us that live in higher income countries, I think, probably assume that we have higher levels of awareness, but actually it is a global issue. And I was struck recently by a piece of research that I read about, and I think it came from Denmark, but it was about when it comes to cancer, women can take 2 years longer than men to get diagnosed. And I actually think that speaks to that low levels of awareness, poor health literacy, not just on the part of women, but I think on the part of our healthcare professionals. So those who treat women or who see women who have concerns. So it's a global challenge. I think it speaks to an incredibly important challenge for ovarian cancer. And I also think it just really reinforces why this kind of global focus on ovarian cancer around May 8th is such an important initiative. And we talk global, but actually, the thing about awareness and empowerment and creating agency for women to act on symptoms is actually driven locally. So we express this as a global statistic, but the solutions are all really about national and local level activity to give women agency and empowerment and the knowledge that they need to act when they do need to act.
I think we as women too tend to put ourselves last and prioritize our families, obviously, first.
It's driven by a number of factors. And we know from our research as well that women actually do experience symptoms and they actually do go to their healthcare professionals. But we also know that it can be several months before those symptoms are prompt investigation. So it's just just critical that we just are very ambitious in terms of raising awareness and improving health literacy.
Let's talk a little bit more about awareness. So, what are some of the most effective ways that you think that people can raise awareness and spark meaningful conversation about ovarian cancer in their communities?
Thank you. What a good question. I think it's really simple. It's about talking, but I also think part of the key to success is about mobilizing. And you will know this, Melissa, from your organization and from what a grassroots effort can achieve. And really, that is where we start, which is we can create resources and assets, and we can even create quite clever campaigns. But it actually is about people on the ground working with organizations like yours, working with women and their families and loved ones who are so motivated and so committed to ensuring that other women are aware of ovarian cancer and on those symptoms. Our campaign generally runs as a social media campaign, but what we see globally is on the ground communities rallying around awareness, and it's in church groups, and it's in choirs, and it's in schools, and it's in workplaces. And so it is about creating an opportunity to have a conversation. Men have a role actually in awareness raising and supporting women to be aware and to act. Our whole community has the opportunity to normalize conversations about gynecologic health and about ovarian health and ovarian cancer, places where people come to socialize, to meet, to work together, are where those conversations need to happen. We're enablers and facilitators. It's people on the ground that really drive it. And that's where we know the success is. It's when a community peer, a friend, a family member introduces that conversation. That's where the kind of success happens in terms of raising awareness.
Yeah, it really does. Any little thing that you do really makes a difference. What you said, and you referred to just men and their part and their role in it, because I think so often they don't necessarily know how they fit in. Our organization, we've made caregivers a top priority for us. So many men and caregivers that said they actually noticed the symptoms first before their actual loved one, which I think is really a powerful testament to men in the role that they could potentially take as well.
And also just that moral support where you're concerned, you have a health concern, you go to your doctor, you think you maybe have IBS or something else, and then and so your own confidence to be able to advocate and represent yourself, it's hard. And so when you have a partner or a family member who, tells you, gives you the confidence, enables you to feel more confident about going back and asking more questions, it is incredibly helpful, actually, and important.
It kind of gives you that army behind you. You feel like you so often, especially as women, your doctor tells you, nope, you're just fine. You don't want to push it, even though you know in your heart that something's not right. Your gut's telling you otherwise, to really give you the confidence to push further and look.
Exactly. We all have a responsibility and a role to play.
Absolutely. Before we wrap up, I do want to ask you one final question. What gives you hope as we look to the future, ovarian cancer awareness and advocacy? What is most hopeful to you?
I think my hope and optimism comes from just watching the global ovarian cancer advocacy community develop and rally together. It is quite extraordinary to see that. And I feel you can't go wrong. That is really where progress will be made, whether it's about awareness or additional funds for research. It's seeing that and seeing the pride and I think growing confidence that this global community has in our work. But I also think we've had some quite helpful developments. I see a lot happening. It hasn't quite translated into interventions yet, but there's a lot happening around diagnostics. There's a lot happening around prevention. There's a lot happening where we have seen advances in better treatments for ovarian cancer. So those things, I think, in my time working with this organization, which is about 8 years, feel I've seen a lot of very encouraging things happening. We still have miles and miles to go. We're at a very important time in the ovarian cancer kind of evolution. And I am confident if we fast forward at 8 years that with the work that this community does, that we will have made significant inroads into better outcomes, better diagnosis, better treatments, better access, less inequity, higher levels of awareness. So I feel actually very optimistic where we will get to in the next few years.
That is really promising to hear. I've seen so much great progress that has been made just in the last few years. And I feel hopeful.
Yeah, I hope maybe in 8 years, maybe we'll come back and have a little.
I know, a little reunion, and the landscape will look hopefully much different and better. Thank you, Clara, for sharing your insight, your expertise, and your passion with us today. I hope that everyone that is listening remembers that you're not alone in this journey, whether you're a survivor, a caregiver, a loved one, or someone seeking information. Global community is here to support you wherever you are in the world. Thank you so much for joining us in the shared mission. Together, we can build a future where no one loses their life to ovarian cancer. Take care and be well.
Thanks for listening to this episode of Teal Talk. We'd love your feedback. Take our quick survey linked in the description or drop a comment with your questions and topic suggestions. For more information about the National Ovarian Cancer Coalition and our mission, visit ovarian.org. Until next time, stay informed, stay empowered, and take care.